EMS's prime role in any kind of event, whether it's a small event that requires 2 or 3 ambulances or a major event that would have 30 or 40 ambulances, is we're the first step in the healthcare system.
And the focus on that first step is on the treatment and transportation of the sick and injured, locating them, evaluating and providing initial treatment, and then transporting them to the appropriate hospital. Along with their treatment and transport role, EMS can also provide an early assessment of the size and scope of the disaster scene itself.
They're some of the first responders that will be on the scene of a major incident. They will be the first people that really, truly give us a size up, an overview of what the scene is, what the incident is, how do we need to escalate, how do we need to begin setting up the system. And then we will transition to be bringing in other resources to support them initially in their primary role.
And that's where MERGE, the Major Emergency Response Group, comes in. The South Central Kansas EMS Region 3 was a pioneer in the concept of formalized mutual aid in Kansas. The devastating Andover tornado in 1991 brought ambulances in from all over the state to help manage the injuries. In follow-up meetings, EMS leaders agreed it would be very useful to know the procedures and capabilities of each licensed ambulance service in this region and their willingness to travel to help in an emergency. Since those initial discussions decades ago, MERGE has grown into a highly organized mutual aid group capable of responding to a disaster anywhere in Kansas.
When the initial call goes out, you get multiple calls, multiple things are going on at Wright County. And typically, most agencies locally are completely overwhelmed at that point. Their resources, surge capacity is really taxed, it's not exceeded. And that's when you really need that first 45 minutes to an hour really sets a tempo and tone for the scene hours later, even days later.
When a disaster escalates beyond the capabilities of local EMS, or when it affects multiple counties, such as a widespread weather event, the MERGE team has the resources and networking of more than 40 ambulance services in the South Central region.
If an emergency manager or a EMS director calls the 1-800 number and says, hey, we need help, then a page goes out. We start having resources head that way. And so depending on the location of the event, we could be there within 30 minutes to an hour with both management people that would help manage the incident or have ambulances there to help treat and transport patients.
After EMS arrives on the scene, the first order of business is setting up a staging area.
And a staging area is extremely important because if you can get that information out to incoming ambulances, then they're not just going to wherever there's damage, they actually report to the staging area, and you can start to have some part of initial control over the entire disaster area.
From the staging area, ambulance teams are then directed to specific areas of the disaster where they are most needed. Once EMS personnel locate victims, they begin the process of determining the degree of injury or illness.
Triage, of course, is a French word for sorting out. And the triage supervisor, all the people that are coming in, you put people in triage and they sort out the most critical patients from the other ones that are less critical, or the walking wounded, so to speak.
We try to do a scene size up, if you will. Look at the scale of the incident that's happened. How many victims do we have? And triage is another way for categorizing or determining the acuity of that particular patient.
In the meantime, a treatment area is established to which the sick and wounded are transferred to receive treatment and undergo a more focused examination. Here, the exact nature and severity of their illness or injury is further determined, and decisions are made as to who gets transferred to the hospital first.
Is it a burn patient? Is it traumatic injuries? Is it an illness? Is there a specialty center that would be better suited for that particular patient? We make that determination. And through partnerships with the hospital and those liaisons determine bed availability, those types of things through EM systems and other mechanisms that we have in place to do that.
And then at that point, you advise transportation that these people are ready to go. The transportation supervisor is making contacts. If we're fortunate enough to have some type of internet capabilities, we can do that via internet. Otherwise, it's old-fashioned cell phone and flares.
Several counties also have disaster medical support units that they can bring to a disaster site in the region.
Our disaster medical support unit, which is a cache of equipment, it's a disaster trailer that can be deployed to a scene that has several different pieces of equipment. It has generators, it has lighting, it has communication equipment, it has other patient conveyance devices to get folks out of tight spots. And we've deployed that on tornadoes in the past, those types of incidences to help people, and it's proven to be a very, very valuable asset and helps us get folks from that particular incident to definitive care much quicker than we have in the past.
EMS also plays an important role in a disaster long after the initial red light and siren phase has ended.
Because people are still going to be hurt, they're still going to need transport, we're going to need to be moving people from facility to facility. There's a number of things that the ESF-8 partners and EMS specifically are going to need to come together and handle.
Even though the local EMS and merge teams are highly effective in a disaster situation, it can sometimes be very challenging for them to meet the demand.
Because along with that incident, you have the normal daily routine calls that are going on in the background, if you will. They still have to be addressed. So it's coordinating with other agencies, other entities to be able to manage not only the scene and the incident that occurred, but those other things that go on day to day in our community.
If we would have a huge pandemic problem, or we would have a huge ice storm that required EMS resources, it could affect our numbers and ability of people to respond just because it was widespread. And again, our primary responsibility is to the local communities in which we're employed and which we serve.
EMS directors realize that their success as an ESF-8 partner relies on cooperation and communication, not just in a disaster, but at all times.
The system of helping each other has been solidified over the years and works very, very well.
We want to make sure that our expectation of ESF-8 partners is that we regularly communicate, that we have our plans in place, and that we routinely have exercises and ensure that what we have in place now is going to work if an actual event occurred.
You know, the state of Kansas was founded and created on the notion of people helping each other. And that's really what our team's all about, is just going and helping.
And it's certainly something that we're all very passionate about, to make sure people get what they need in their time of need.
To learn more about EMS and their response capabilities in a disaster, please refer to the resources that are provided with this video.